The science. My name's Betty Alice Faye Mangan. I go by Alice Mangan. My mom went by Betty. I actually got into the science of this when I needed something for myself. I had been suffering from chronic autoimmune disorders and diseases and a lot of other things like degenerative disc disease, thyroid issue, carpal tunnel syndrome. Then I got diagnosed with fibromyalgia, irritable bowel, all these types of different types of migraine triggers. So everything seemed very obnoxious to my body. And then I got MS, and that's when I had to really dial it back. I started living on that brown couch over there for about 6.5 years between the couch and the bed, and only short little bouts of energy and feeling like I was a normal human, but most of it was depression and more diagnoses. The pharmaceutical routes was not helping me. The VA gave me anything and everything they had at their disposal, and people know how the military is. They can get lots of great stuff, but it wasn't working for me. And come to find out, it wasn't working for a lot of other veterans. I got selected in 2017 to go look at cannabis as medicine out in Colorado at the university, where we got to meet with a lot of great researchers. They were the scientists, they were the forerunners, they were the people that said, wait a minute, this is medicine. So when I got to go out there and eat pasta, have dairy, not use opiates or sleeping pills, not have to use Ritalin or something to stay awake during the day because I also had narcolepsy. So all of these pharmaceuticals I didn't even have to mess with. And so when this looked more like science versus an excuse to get high, I had to take notice. I'm a registered nurse. I've been in the care field since my military days. All I know is looking for answers inside the body, and inside our body we have what's called the endocannabinoid system, or inside cannabis system, which actually is about these receptors and molecules that our body uses these substances, especially when it can't make them anymore. People kind of get astounded to find out that it's not endorphins that make you feel high after you run, but it's actually what's called anandamide. That is our own body's basically THC molecule. And so I didn't even get that when I was in the military. I was so deficient in these molecules, in these lipid signaling neurotransmitters, that I didn't get the runner's high. I just felt more exhausted. I just felt more defeated. So just even like exercise and activity feels better using these molecules. It doesn't put me in the couch. Knowing that there's other molecules in the plant besides THC, I can use CBD as kind of a general maintenance, touches every cell, even down to the DNA, and THC can't do that. But then we have things like CBG or CBC, powerful anti-inflammatories, powerful neuroprotectants, and even neurogenesis. We also see them showing a lot of promise in cancers and stuff, which has been on the forefront of everybody's mind for years now, but definitely in recent years. We're talking pediatric cancer even. We have them on our things that is helping them mitigate either symptoms or side effects of the chemo or radiation they're doing, or they're doing it without those things. And they're looking at wholly nourishing the body to do its job. So I like to talk about the science.